Hello, my name is Walker Plash, and I'm presenting my research, No Change in the Use of Antivenom in Ohio for the Treatment of Copperhead Bites. We did this research through the University of Cincinnati through the Emergency Department. I worked on this with Uwe Stolz, Sheila Goertemoeller, and Edward Otten. First, for a little bit of background, historically Copperhead bites have not been treated with antivenom. This is for two main reasons. The first reason is that antivenom is associated with adverse events. And a lot of the original studies were looking at the original antivenom, which was horse-derived. There was a much higher rate of adverse events, including anaphylaxis and serum sickness. The other issue is that copperhead bites are, in general, not severe. So you have local tissue destruction, but you don't have much systemic response to these bites. So there's little benefit in treating these patients with antivenom. So with the combination of adverse events and little benefit, these patients usually in the past not treated with antivenom. However, there have been several recent studies showing improved outcomes with antivenom use. So this is looking at return to work as well as pain control. So with these new studies coming out, we hypothesized that the frequency of copperhead bites treated with antivenom would increase over the duration of the study. So what we did to take a look at this is we did a retrospective review. We took all of the copperhead bites that were reported to the Ohio Drug and Poison Control from 2006 to 2016. From this data, we abstracted the demographics of the patients who were bitten by copperhead snakes. We also abstracted antivenom use, so whether antivenom was used or not, and if it was used, how much antivenom was used. We also took a look at bite severity, and we also took a look at hospital disposition, so whether a patient who was treated in the emergency department was discharged home or admitted to the hospital. From this information, we did a test of trend to evaluate antivenom use by year, and then we also did a logistic regression looking to evaluate the characteristics of patients that have favored discharge home or admission to the hospital. So here is our results. So as you can see, this is a breakdown from 2006 to 2016, looking at the number of snake bite patients as well as the proportion of patients treated with antivenom, their disposition, and the number of patients, or the number of antivenom vials that were used for patients that were treated. So as you can see from the p-values down there at the bottom on the test for trend, there was no significant change by year in any of these categories. So the number of patients that presented to Ohio Poison Control did not change year by year. The number of patients treated with antivenom did not change, and the proportion of patients treated with antivenom did not change over the duration of the study. The other thing we did, as I mentioned earlier, was we looked at a logistic regression for admission versus disposition home. And there were two main things from this study that changed the odds ratio of admission. So the first thing was the local severity scale. So for every 1 point increase in your severity scale, you had an odds ratio of 4.6 of being admitted to the hospital. However, independent of that, the use of antivenom was associated with a very large increase odds ratio compared to no antivenom use. So if a patient was bitten by a snake, a copperhead snake, and treated with antivenom, their odds ratio of being admitted to the hospital was 46.7 compared to a similar patient bitten by a similar snake with similar response and similar severity who was not treated with antivenom. So first, there are a couple limitations to the study. This data was collected from 2006 to 2016, and since that time there have been additional studies talking about the benefits of treating patients bitten by copperhead snakes with antivenom. So it is possible that if there is an increase, it will actually be in the future, or since this data has been collected. The other issue is that this is only from Ohio, so this is only looking at the way these patients are treated in Ohio, and it's not taking into account if patients are being treated differently throughout other states in the United States. And then the last limitation is that this grading of the severity was performed by multiple different providers at Ohio Poison Control. So as multiple different providers, we don't know how reliable those ratings were between providers. And the other issue is that they were making these gradings of severity via phone discussions with providers who are taking care of the patients in the emergency department. So that being said, with those limitations, we had a few different conclusions from this study. So first, as we talked about, the frequency of antivenom use for copperhead bites did not change in Ohio from 2006 to 2016. which kind of goes contrary to our hypothesis and what we thought would happen. The other things that we found is that the administration of antivenom was associated with a very large increase in odds ratio of hospital admission, even independent of bite severity. So in the future, if there is an increase in the use of antivenom for treatment of these copperhead bites, we'll possibly see an increase in hospital admission for these patients as well. Thank you very much for your time.